Welcome to episode 78 of the Preferred Experience podcast. I'm Chris LeSueur here with Dr. Trever Wilkins from Metta Medicine. Also works out at CrossFit Preferred, does jiu-jitsu, runs, does yoga, does all kinds of good things, and knows his stuff on health and fitness and medical and all the good stuff. Also an ER doctor, has a really large resume.
Well, thanks, Chris.
All kinds of cool stuff. So a few weeks ago, was telling Trevor my energy level has been feeling kind of low. And I will point out that in May, I did rim to rim again. And then in June did Mount Whitney, which is the highest peak in the lower 48 states. We have a little fly that keeps flying in here, but wants to be on the show today. So did both of those, and after that felt really low energy. Felt a little lower energy even before that though, but it could have been all the training, all the different things. So ended up getting a blood test, and basically self-employed, I work for a family business, and also own CrossFit Preferred. So insurance-wise, I don't have like these awesome medical plans where you go in whenever you want and pay $10, for a copay or whatever. And so it's a little more commitment when I go to get something done. But working with Trevor, it makes it affordable and works out really well. So you could tell a little bit more about what you do with Metta Medicine.
Yeah, definitely. So I still work in the emergency room, standard medicine, and Metta Medicine was made because of my interest in really focus on optimal health, and working with a population that's really fun to work with. And really it's the demographic that you fall into, people that are really proactive with being healthy. And so Metta Medicine caters to that type of medicine, but also makes it affordable for the once again, the small business owners, people that don't have those large insurance plans, where labs, imaging, the exams are a lot more affordable.
Yep. I forgot to ask you this before, but what does it normally cost someone to get their labs roughly, like if they go through you?
Yeah, I mean, if you're looking at just the basic labs that you kind of get every time you go to a physical, it would be like around $50. And so, that'd be CBC, CMP, and lipid. So that's looking at your cholesterol, your liver, your kidney, just how, if you have anemia, those type of things. And so you could, and then once again, you can get a very comprehensive test that your typical office visit you're not going to get, for $300 and or around there. And yeah, if you can show up to any lab and get the same blood work, but it's gonna usually cost at least twice as much.
Yeah, we Tirsa wanted to get her blood tested a year or two ago. I forget what it was, and the place she went to sent us how much it was going to be. It was $1,500 is what they wanted for that. So I think we talked to you after that, and you're like, well, we could do this, and made it way more affordable, and it got us the same information that we needed for her, and helped her a lot. So.
It was a fraction of that. Yeah, absolutely. Yep. Yeah, once again, that's rewarding. I'm in the same situation. I'm technically an independent contractor, and so I sympathize where medicine isn't accessible, and and it's frustrating. So this is kind of my way of making it more accessible to people that are working hard and trying to do the right thing.
I actually got really interested in blood work listening to Tim Ferriss years ago, and he would do all these tests, and I've wanted to do some of the same things. So we started with you did a different panel for me than like a normal just health one. You kind of did more like fitness related levels and different things. So we could go over what we went over from my panel, and kind of share why you did that, why you wanted to test that.
Definitely.
Could be informational for everyone.
Yeah, perfect.
So,
I hope so.
The first one that you did with me that I was surprised on was my platelets.
Mm-hmm.
So why did we test platelets?
Yeah, so when we talked about those, just basic labs, like anytime you go to a doctor, they're going to get a CBC, a complete blood cell count.
Mm-hmm.
So that's going to have your white blood cell count. That's going to show if you have an infection or if you're stressed, inflamed. So first of all, sometimes you can have we were talking about, fatigue and that type of thing. So sometimes you can have a viral illness. I mean, COVID, of course, that's on everybody's mind, but not
Mm-hmm.
just that. You have Epstein-Barr virus. You have just a whole slew of those.
Mm-hmm.
So you're going to get or an inflammatory process, autoimmune, etc. So as far as weakness, you're going to the CBC is going to tell you about that. Moving on to your hemoglobin and hematocrit, those are what are associated with anemia, and they carry your oxygen.
Mm-hmm.
So somebody that's anemic, if you are only at about 50% capacity or a fraction of where you should be with the cells that carry oxygen, you're going to be fatigued, you're going to be tired. It's going to be you're going to feel like you're on Mount Whitney every day because you're just not circulating the blood. So that was another reason I wanted to order that test. Now the platelets that's kind of funny. I wouldn't have anticipated that being low on you, and so
I was a little low. I was at 137. It says 150 to 450 is good.
Yeah.
So it wasn't critically low. I noticed there's a critical level.
Yeah.
And then there's a low.
Far from critically low. So once again, in the emergency department, you have to get down to like 20 before you start actually transfusing platelets and worrying about it and getting bruising and those type of things. So so in your case with the platelets being low, we just kind of scratch our head a little bit, and we kind of go through like some of the questions of, well, why would a platelet count be low? Is there an autoimmune thing going on? So autoimmune would be like rheumatoid arthritis, lupus. Yeah, you're not describing any of those results. Family history, you don't have any of those type of things. Health issues, alcohol can cause that. Liver, spleen problems, no issue like that you'd have. Infection. So once again, infection's always kind of in the back of our mind. You really hadn't had any of those symptoms, but you had a good question earlier about. Do you want to?
Yeah, I was curious. I Googled it because it was like the fastest thing for me to do because I was curious on the platelets, and it brought up that elevation can affect platelets, but I was only at elevation for, I guess 10 hours. I was out there 17 and a half hours that day, and probably 5 hours of it I was above 13,000 feet and then up to 14,500. So it said that could have had an effect on it, but that was like a little less than a month before I even did this test. So I don't know that would have anything to do, but it just like question that came in my mind. I wondered.
And that's really like my favorite thing about being a physician is the patient-physician relationship, because there's a science of medicine and the art of medicine. Like there's not a day in medical school where we sit down and talk about, hey, what are the platelet reaction to high elevation? Sometimes you cover that, but there's just no way to cover all those, and so you have to have a discussion, with like we did earlier, and think about what we know and see what fits. Essentially an educated guess, right? Sometimes it just comes down to that. The thought that we discuss is just putting your body not only under the stress of elevation, what is it, 14,000 feet? So the highest in the continental.
It's the highest in the lower 48. 14,508 is what it is.
So huge amount of stress, not to mention 17 hours of hiking on top of that. So platelets, they also have, so they help to clot the blood, and then they also have some important functions with the growth factors are involved with the platelets that help heal your body. Even when we're talking about healing the body, when we exercise, every time we do that, we're stressing our body in a calculated, dose appropriate way. So that's something that we say, you're not symptomatic, you're not bleeding, you don't have any of these other symptoms. Probably has something to do with the high amount of stress that you put your body under. Not only at Mount Whitney, but just you work hard all the time.
Stress in life. Can it have an effect on it too? It sounds like.
Yeah, to a certain extent, but just physically. What you're running, rim to rim. You're training for that. I mean, you're putting yourself under a lot of stress. Not to mention.
It's what keeps me sane, though.
Yeah, absolutely.
There's something to be said for the mental part of it, too.
Oh, absolutely. I'm the same way. It's funny how that works, that beating our bodies up is what our bodies need, in a healthy way. It's done in a very healthy, calculated way. But there's definitely stress, and that's the value of exercise, is the recovery process.
And I don't do as well on that as I could. Like, my recovery, I need to come up with a better game plan, because I don't do the best at that.
Yeah, it's kind of funny how as we start aging, getting
it's
a little
changed.
It
I'm
changes.
44. It's definitely changed.
I'm in the same boat, and it just becomes it becomes very clear like how important that is, and you and I are always talking about sleep and nutrition and all those things. So but that's what we do. And when we had that conversation, we say, okay, platelets are a little low right now. And we recheck them probably at least on an annual basis. And then
at a minimum, annual's good.
Yeah, I think so. So at this stage of life, unless in your specific case. Now, once again, we were talking about earlier when we were going over the labs. Why don't you talk about what you were thinking?
Yep. So I was gonna ask a question too that came up on anemia. Is that something you see in men very often, or is it more women? Because I would think more women. Yeah,
less frequently in men. So for a couple different reasons. The main one being that during the menstrual cycle with women, they shed a lot of blood and have to recuperate that, and so they more often have that. Men have a higher level of testosterone. Testosterone stimulates the hemoglobin as well. So
Can anemia happen with someone that's working out super hard though? So is that why some people that shouldn't do this, or that have been getting in trouble even in CrossFit lately, doping? I guess that wasn't happening in the most recent thing, but we had a couple teams in the CrossFit Games get disqualified. Yeah. And it wasn't because of doping, it was because of some chemical that they did or didn't know about in one of their supplements.
Yeah, so there's appropriate. As far as you think about what the treatment is for anemia. So those people probably weren't medically treating their anemia, right? Sometimes there are appropriate situations. Rarely, most of the time, you treat anemia with nutrition, going back to that. More iron, taking supplements if needed. That's the most common form. Sometimes you can get prescription strength iron supplements.
I know Tirsa takes it.
Yeah, very rarely is somebody gonna take a medication that increases. And so that's why it's a performance enhancing. So I think with whether it's that CrossFit or the Tour de France, or any athlete with an endurance capacity is gonna
recovery is what they need.
Well, and by doping, what that does is, we talked about briefly earlier, if it's too low, you don't circulate enough hemoglobin that carries that. But if all of a sudden you have 150% increase in the oxygen delivery, you're going to get that much better performance and utilization of oxygen. So that's one of the reasons why doping is so helpful for people that are trying to get an edge.
That's why they do it.
Yeah.
So the next one that I was curious on is glucose and it's not creatine, it's creatinine, right? So I read it as creatine earlier.
Yeah,
That's a different word though, isn't it?
Yeah. So you have the supplement creatine, and then your creatinine, and so and so what was your question about it?
So I take creatine daily because I've heard it's fine to do, it's healthy to do, and so I've been adding that to my protein shake for quite a while. When I saw this up until this moment and hearing you say the word, I was like, you're saying it wrong. I was reading it as something different. So so I stopped taking it the last week and a half after getting the results back from this. It's like, well, maybe I need to take a break on that. And another thing too, I haven't been lifting that heavy the last little while because I hurt my back 5 weeks ago, and I've just been playing it safe and kind of took a bit of a off season the last little bit.
Yeah.
And just because I went pretty hard from last summer till about a month ago.
Yeah.
Did a lot of things training wise. And so I wondered, with my back going out and taking a long time to recover, I wondered if maybe it's time to take a little bit of a break. So I did.
Yeah.
But I didn't do it all the 100% right way. I had a lot of sugar and a lot of treats the last little while, and did an after vacation body scan and body scan that we have here. Wasn't real happy with that, but I kind of got what I earned the last little bit.
Yeah. Goes with life.
Yep. So I noticed my glucose was high. So I wondered, was that because I've been having a lot of sugar the last little bit?
Yeah. So these things we need to take into context. So both of these, and this is why it's nice to have a physician-patient relationship. By the way, sometimes people think that the medical community doesn't like people researching. Say, hey, stay away from Google. I love it.
Yeah.
Because I want you to come up with every question. Sometimes you go to Google and like, oh my gosh, I'm going to die. And it's like, perfect. Let's have that conversation.
Yeah. There's a lot of doom and gloom on Google when you search it.
Yeah. And so I think that's why some people are like, no, just stay away from Google. I think do your homework, do your research, and then let's have a conversation about it, because you are going to be able to spend so much more time on your individual health. It's not realistic for me to spend hours on everybody's health, but you can delve into there, and then we can talk about some of these and have a discussion, with some of these concerns, and then we can say, hey, you're not going to die. It's really not as bad. And athletes are funny. You're so critical on yourself. So the normal values. 99, you're at 104. Now, typically, I didn't have you fast for this, or were you fasting?
I did. Yeah,
you were fasting.
Fasted.
Okay, so it is,
but only 10 hours, maybe.
Yeah,
maybe I should have done longer.
So there's a lot of things that can affect that. So and it, once again, 99 versus 104. You're just a little outside the normal range. And last time we did, once again, being conscientious of not overspending on a bunch of tests, we did a hemoglobin A1C, which trends 3 months worth. And that gets you a better idea, the average of how often your glucose is going to be high. And so that would have, now looking back, I would, because yours was so good last time, we didn't do it, but maybe next time we do a hemoglobin A1C and an insulin to get the comprehensive picture. So this in and of itself, you could have, first of all, it's a good motivator to clean up the diet, for sure. And sometimes measuring some of these things can be great. But the other thing you take into consideration, sometimes after, sometimes you can be fasting, you can be spot on with your diet, and you'll get these little spikes. You'll get a spike after a workout, different times of the day.
What were you sharing earlier that after a workout you...
Oh, yeah. So I had some blood work done for life insurance. And so after the workout, my creatinine, which we're going to talk about here, was sky high. I had a urine sample done, and it had a bunch of these abnormal globulin proteins in it, and that's what you would expect to see in like a diabetic, geriatric patient, that their kidneys were just like getting ready to collapse. But the so the life insurance, they wanted to deny me, and
man,
like I'm like, I'm like young and healthy, so I'm like please just come back. Let's recheck everything. I didn't work out that morning because I did the blood test right after. It was after a CrossFit workout, and when I repeated the blood work, everything was back to normal. Like after 2 days.
It's interesting.
Yeah.
It's
So
funny.
once again, as we were talking about the platelets, maybe those were affected, but we really train our bodies to beat themselves up and then heal themselves with the exercise. I mean, it's funny that's so healthy for us, but we
really
physiologically,
does help.
and that was with CrossFit. But it would have, if I'd gone out and done a rigorous track workout or a long run, it would have looked the same, if not worse. And
it's interesting.
So anyways, so the glucose, but once again, the adage of what's measured is managed. I mean, it's motivating, right?
I found it motivating.
To see those numbers and be like, whoa, this is I need to step up my game.
I did my best to put it out of my mind last week while I was on vacation. I didn't want to think about it.
Fair enough.
But I'm back. And the off season's over.
Absolutely. And I think that's the other thing too is we're looking at the long haul of things. This is, once again, we did the same thing last year and compared, which was kind of nice, right? To be able to have those different data points in trend.
It had been over 2 years.
Had it been that long?
Yeah. Since I did the last one.
Yeah, probably doing it on an annual basis would be a good idea. We should plan on that. And but having those data points is my wife makes fun of me because I get so scientific about like this exercise, and but it's
love it.
I think we're from the same stock, but having these measurements it's so helpful. It's motivating. It gives us great feedback to maybe change how we're approaching whether it's nutrition, exercise. And once again, it's the other thing too. We're talking about higher cortisol levels and diet, sleep, huge part of that.
I really worked hard at that the last while. Really the last 2 years. Sometimes better than others, but during the summer I've been able to get more sleep.
Awesome.
I don't have to get up so early to work out. In the normal school season.
That's right.
It's like wake up at 4:15 to get the workout done. So
at
least when I come here.
No, definitely. So those but anyways, awesome data points. And then do you want to talk about
so one other thing, we talked about this a couple weeks ago. You got a glucose meter, right? And so we talked about getting me one. I'm curious just to see, because now it's really easy to do. I think you just get a patch, and it can transmit to your phone. There's like a Bluetooth thing on it or something, and you can see what your levels are. So I think it'd be really interesting to do that for a couple weeks or however long you suggest, and see. Could be an interesting podcast.
Oh yeah, I did. I ran into some technical difficulties and I did it, but I loved it. When it lasts, you get so much immediate feedback and it's all recorded. And especially when you combine that with something like what you and Tirsa do with macros, recording your meals, seeing how you respond to different
it'd be
meals.
Interesting.
It's huge because everybody responds differently to different foods, and there's so much complexity and variance with us. Having that type of data is super fun. So we do. I went back to the drawing board. The one that I used was great while it worked, but it came out a little too early, and so I'm trying to find. There's a couple that I'm checking out.
They need one for athletes. They're
They
probably
do.
made for a lot of people that are pretty sedentary, I would bet.
Because at a minimum you have to make a few adaptations to it with securing it, because it popped out on me.
I wondered about that.
Yeah.
So the next one was, it's creatinine, Okay.
Yeah.
Mm-hmm.
Yeah. So
I was at 1.28. The high, or the normal high, is 1.27, so barely out of range.
Yeah, negligible. So I mean, essentially, you're on the higher end of normal. And once again, even just exercising on a regular basis, you'll expect that to be on the higher end of normal. So a little bit lower, you have the GFR, and so that's the glomerular filtration rate.
Mm-hmm.
And it is a little complicated explaining. There's a calculation with how much you're filtering, into the kidneys and then reabsorbing into the blood.
Mm-hmm.
But your GFR is normal, and so that's reassuring. So
Mm-hmm.
it's filtering well. You just have higher levels, and I think it's because all the running, the lifting, et cetera, that you're doing.
Mm-hmm.
You're just breaking down your muscles in a healthy, calculated way.
Yeah.
And you have higher levels than most of the population because you're an athlete.
Okay. Cool.
But still
interesting.
Still,
Something to keep an eye on.
What do you do for that though? Once again, it's good feedback to. Even though it is calculated, it's a good case for hydrating. That's going to be the best treatment for that.
That's interesting.
Is helping your kidneys your kidneys just like to have a lot of fluid. Like if somebody comes into the emergency department with kidney failure, the main treatment that we do for
IV.
them is hydration. IV hydration. Oral hydration is awesome. It's just IV
takes longer.
IV, it's a nice little
We'd pee
hack.
it out too fast if we drink it all.
Yeah, it is just
when
a little
you need
cumbersome.
it right away.
So but anyways, just good healthy water for athletes.
Cool. Next thing I was happy about was like my sodium, potassium, chloride. They all seemed like they were in a good range, which in the summer here I thought that was pretty good. Pretty awesome that it was. And I wonder if it'd be different after all the running. I haven't ran as much the last little bit, so that's hard to stay on top of.
Yeah, I think that if there were any changes, it'd be very transient.
Mm-hmm.
Like if you took it right after you ran 10
it'd be
miles.
a mess.
Yeah, but I think that you would recover really, really quickly with healthy diet. The thing that I like the most about this is, once again, it lets us know that your kidneys are working really well and that you're responding appropriately.
Cool.
Your organs are essentially working really well.
Good. And then what's AG ratio? It says I'm a little high on that.
Yeah, so that has to do with the proteins that your liver makes, and so your alkaline phosphate was just a little low, which is surprising to me. Those things are negligible, quite frankly.
Mm-hmm.
Like I wouldn't even worry about.
But
that.
maybe cleaner eating, better hydration could help.
So
in the long term?
Yeah, generally speaking, with the liver and the liver enzymes, just a healthy protein, like getting adequate, good source of protein is going to be the best. But to put
which most people don't get enough.
I think athletes performing at the level that they want, I think that it's very challenging to get the amount of protein that would be ideal. Once again, with what you and Tirsa do with macros and the nutrition planning, which I personally have seen amazing results with sticking with that. It's a full-time job. Trying to get enough, enough protein. Once again, I'm very reserved with. I think that nutrition is very individually based, and so someone like you or me, where we're trying to increase muscle mass, performance, I think that it's hard for us to get the amount of protein that we want for our specific needs.
Mm-hmm. Then the next thing is LDL cholesterol.
Yeah.
I was a little high on that. I think we talked about this 2 years ago, and I was a little bit on the higher end.
Yeah.
Is this something I need to be focusing more on, or that people need to be focusing more on?
Yeah, that's gonna be diet.
Mm-hmm.
LDL, unfortunately. So the fortunate thing is, your level is, where are we at? 109. and a high normal is 99. So once again, you're not going to go to a doctor that's going to say, hey, you need to get on a statin, or you're very, very close. You're not to the point where it's pathologically high, where you're just really at a high risk. But as athletes, we're very conscientious, and we're kind of performance oriented.
Because of that and a couple other things, I want to retest in a couple months just to see. I want to focus on I plan to focus on my eating and nutrition, and I'd love to see what happens with that and other things.
That's where you're going to get the high yield with getting that timed up. LDL is going to be, one, genetics, two, first and foremost genetics, quite frankly, but we can't use that as an excuse. Diet is going to be the most impactful thing that you can do to change that.
Okay, cool. And then let's see. Then we went over testosterone. Testosterone, I went up quite a bit from the last time. I was in the 400s. Yeah. That was 2 years ago.
Yep.
And I attribute that to I was not sleeping good. I was actually at 496 August 30th of 19, and this time I was up to 647. I don't know if that's great or if I should still be trying to improve that, or what you'd recommend on that.
Yeah, so once again, testosterone is going to vary. It's going to be higher in the morning. You're going to have ebbs and flows of those levels, and so there's a lot of things that are going to affect that. So one of the things that I think that you nailed it. Talk about sleep. That's huge. Stress reduction is going to, just being mindful of that. Having constant stress, worry, taking some time out for yourself is going to contribute to that. Huge one is what you're doing in the gym. Heavy lifting, so the squats, the deadlifts, just that rigorous exercise, is all of those things are going to increase your testosterone level. Diet is huge. Actually, we were just talking about cholesterol, so mixed bag, right? Cholesterol is kind of the building block of testosterone, and so getting good quality, like there's good nuts that's a great source of good cholesterol. Making sure that the quality, different types of, avoiding margarine, true butter, those type of things if you're going to use it.
Which I don't have a lot of. I don't have a lot of those things. Yeah. But I do have a weakness for cookies and ice cream, and that's in that stuff. So. Mixed bag, right? So
if you were looking at diet, like the emphasis would be just getting a really good source of fat. So replacing the cookies with some type of whatever
that's the plan now.
Yeah. But
I was being weak.
Well, you're being human, right?
It's okay to have. I'm not actually maybe as strict as I need to be on that, but I really believe in like the 80-20. Yeah. But I was definitely not doing 80-20 for a little while. Yeah. Tirsa always teaches in our nutrition program that the line's not always straight. Yeah. Like we're gonna have problems every once in a while, or not problems, but just we might live a little sometimes, and
this is a healthy outlook. Yeah. There has to be a little bit of balance. Yeah. So overall, once again, the number's a good part of the equation, but the most important thing is how you feel. And so the question is well, should it be higher? Well, I mean, I think that we're always gonna, if you can, with awesome diet and healthy lifestyle and exercise, get it to be higher. Heck yeah! I mean, the higher, if you can get that up to 900, what you'd expect to be when you're 18 or 20, that's gonna be awesome. But if you're at a level and you're recovering well, you're performing well, you're gaining muscle mass when you want to, that's great. The symptoms to me are more important than the number.
Okay. So with someone that I know sometimes you'll help people with what do you call it, testosterone replacement or
hormone replacement therapy, testosterone replacement therapy.
Mm-hmm.
Yeah.
So there are some people that I know that do that, and it helps them. But some of them were like super low, like 200s.
Yeah.
And so I'm just wondering, at what level would you recommend that for someone?
Always individually based.
Mm-hmm.
And in that, like any decision that you come up with a physician is gonna be the benefits versus the risk. So once again, like the conversation that you and I have had, there's no symptoms of low testosterone that you're worried about. And a lot of those can be like, depression, decreased libido, or ability to have sex or interest in sex. You're just performance overall, not maintaining muscle mass, can't get rid of belly fat, like those type of things. So, if you have two people and they have the exact same number, and one says I have none of those symptoms, no, it's probably not a good idea to do it.
Yeah.
If somebody has the same numbers, let's say you're in the mid range, kind of that gray area, and it makes in you understand the risk and the benefits, and then for that person it could make sense. And so it's always individually based. I mean, there's some numbers, you're below 200, it's like you really, it
would help them.
You need, like, it gets to the point where you have complications from it being too low, cardiovascular and your bone density and these different things, huge on your mood and affect. So there are some times where you're just like, you absolutely should, if there's not a contraindication to do it. But at the other time, like there are instances where if you're on the lower end of normal or in the mid range, but you're having symptoms that are problemsome, where you go ahead and do it.
Cool. And then the one that's always, last time every time we do the podcast outside, something happens that's loud. So the street sweeper's going by. But we've done pretty good overall this whole podcast.
Can't complain.
So it's not too bad. So the one that's really surprising to me, I'm outside a lot. I'm not outside a lot during the day though, but my vitamin D level, it was better this time than last time, but I'm on the very low end of vitamin D. Last time I did it, again, almost 2 years ago, 28.5. This time, 31.1. And would you say, I've wondered, is sleep a factor on that and testosterone? It seems like I heard something the other day that I really liked, and it was talking about, it was on a cool podcast called Best Hour of Their Day, and it's for CrossFitters, basically. My friend Marcus helps them with some things and in different things, but so they talked about sleep, stress, nutrition, fitness. They said if any of those four had to go, have the fitness go away. So that says a lot. So sleep, stress, nutrition are the main things to focus on. I think the fitness helps with the stress. Yeah. And it also motivates me to want to eat better and sleep better. Like it all kind of comes together for me. Yeah. But again, just super surprised on the vitamin D. I'd be curious to see what you recommend. I kind of have an idea, but
it is funny that in Arizona, that we are collectively so low on vitamin D. You think that if there was any place in the world where that would not be the case, it would be in Arizona. And the thing that so vitamin D, one of the best ways to get that, or probably the best way, is through sun exposure. Like you had mentioned about being outside. There's an app out there called D-Minder. I've told you about it.
I've shared it before on here too. It's cool. I need to use it more, obviously.
I'm guilty of the same thing, and I think that it's great because it helps you balance not getting too much, but getting enough in optimal time in the sun, optimal time of the day. And so my recommendation to you is use that
Take my
pool in
shirt
the
off
backyard.
more. Get that tan.
And
I did that last week, by the way, in California. We were at Newport, the family. I have a tan right now, and I normally have the worst farmer's tan of anyone I know.
Yeah.
So I actually have a tan. So I wonder if my D levels could have increased last week.
I know we should like draw you today and like see what your D levels are.
Yeah,
That'd
it'd be
fun.
interesting.
We really should.
Mm-hmm.
And I wother how much of a vacation on the beach has to do with your D levels increasing. I thought about that last time I was
test it.
I was at the beach, because the energy level has been a major concern, and that I think is a big contributor to it. Being on the lower end of normal. And are you still supplementing with vitamin D?
I haven't been taking vitamin D.
Yeah, and so I think that if you're in a situation where you're on that lower end of spectrum and you're fatigued, I mean the upside of taking a vitamin D, you're not going to overdose on it. You'd have to just.
So it'd be worth taking a supplement again and getting more sunlight.
I would.
So you were recommending put sunblock on your face. And wear a hat, because I burn on my nose faster than anything.
Yeah.
And but it'd be good to get a proper amount of sun for the rest of my body.
That's my personal take. Like if I go running, I'll put it on my face, and then my neighbors kind of have to bear with watching me run down the canal with my shirt off sometimes, because I think it's a healthy dose. And like sometimes I feel a little kind of shy about it, but like
I've felt that.
Yeah. But I'm like, I don't care. Like I think it's healthy to if I'm going out for a 20-minute run, and I'm kind of a weirdo. Sometimes I'll run a little during the middle of the day, even when it's hot, which I wouldn't recommend if you're not used to it. Mm-hmm. But like I that's exactly what I do. I put it on my face, and then I try to get just a little dose, because my face is getting pounded. I grew up in Arizona. I started seeing some of the pre-cancer for squamous cell at the age of 20, just from playing a lot of baseball and football and everything else outside growing up. And so the other part of Metta is we do facial aesthetics.
You do aesthetics, yeah.
And so you can the face takes a pounding, and so I more surface area on the legs that seem to tolerate it better for me anyways. I haven't seen any signs of the cancer there, and so and the torso. So that's what I do. That's what I recommend. Everybody has to make their own decision with that, but that's I think it wouldn't be a bad way to go.
The interesting thing for me, my legs have shown more sign from the sun than any other part on my body.
Yeah.
So I went to the dermatologist a couple months ago, and I had him checked out. I was like, what the heck's going on?
Yeah.
He's like, well, we call these barnacles, and they're just like things that happen. None of them were cancerous, luckily.
Yeah.
But he was teaching me that that's just something that happens with age. I had a couple on my forehead, same thing. So we got rid of those.
Yeah.
And looks better. But what kind of aesthetics? So I know you help people with mainly their face aesthetics, right?
Yeah.
So you do what are the therapies that you do?
I like, once again, when we're talking about skin, I mean, skin is such an important organ of the body. So as you're talking about this, I mean, it's kind of funny, you do aesthetics and you're looking at everybody's skin. So, you have 44, like you mentioned earlier. I mean, you have great skin. You're taking care of yourself, and that has a lot to do with the nutrition and the exercise. And quite frankly, every time I see you, or about 90% of the time I see you, you're wearing a hat, which is a good idea in Arizona.
It's because I don't want to do my hair before I come to the gym.
But it helps out a little bit with giving a little bit of extra shade. So first and foremost, like with aesthetics, like I think that just being healthy is going to help you look better, and that's the most important thing. And so if that means losing weight, exercise, I love pushing people over to CrossFit, because I think it's the best efficient way to get, if you have an hour and you want a great workout that's going to be comprehensive, do that. So first and foremost, like lifestyle. The other aesthetics that I really like are the things that augment your natural process. So we do microneedling, where you take little needles and you stimulate the skin by doing microtrauma. So in exercise, we do a little bit of trauma to the body by exerting it and doing those little micro tears. Microneedling to me is the exercise of the skin, and so by creating a little bit of trauma, it stimulates elastic and collagen in the skin, and you get a nice growth. If you really want to get a nice effect with that, we do a little bit of topical stem cells that augment that whole process. So they have the growth factors that really cause the skin to grow and to be more youthful. Like it literally like reverses age. I love it. And then the other thing too is PRP. We take the blood, we isolate the growth factand then you put your own blood on your face, which is kind of funny, right? It seems barbaric, you know.
Sounds cool to me.
Yeah, it works great. And it works great for the face, and it actually stimulates hair growth.
Yeah, I was going to ask you about that.
Yeah.
I'm starting to thin a little bit right here in my 9-year-old that turns 10 tomorrow. She lets me know. She's like, "You're getting bald spots."
Yeah,
like, thanks.
Kids are great for that.
She's very honest.
Yeah, absolutely. It's going to happen to everybody, and so these hacks that you can do with either taking your own blood or stem cell. Actually, we have a great the taking your own blood. It's a whole process, a little bit more pricey, but like the results, people love it. I mean, it really works. It's way better than a hair transplant, and way more affordable. But we can do that. There's an even more affordable option where you can do microneedling with stem cells on the scalp. You get great results.
That'd be interesting to try.
Yeah, you know, and in my thought process too, because I'm thinking the same thing, is you do that every 3 months, which is about the cycle of a hair follicle, and that preventive measure is going to be a lot better, because once it gets to the point where there's no hair anymore, you do need a transplant. But if you can stay on top of the hair thinning by doing, whether it's stem cells, and then there's different peptides, different pharmaceuticals, Rogain's the most popular one, finasteride, a lot of people know about that. But yeah, we do all of those in the practice, and they are very, very effective. And it's kind of funny because you get to our age and you're like, I'm a guy, I don't care, you know, but then you don't care until it happens to you.
Yeah.
And you're like, I do care.
I kind of care. Yeah.
Even
it doesn't just happen to guys. I noticed women that have it happen too.
Well, women have a little bit more sense than us men, I think, typically about that type of thing. No, for women especially, particularly, have a lot of women, like after they give birth,
they lose
a lot of hair. You get a great bounce back from that, and then once again you start getting in menopause and your progesterone levels are changing. You can get hair loss with that as well. Once again, that's another time that's appropriate to do some of that hormone replacement therapy, making sure that's balanced, doing some of the treatments for women, absolutely. And women are a lot more open to procedures like that than men typically are.
Yep. So let's see, any other things that I think we went over most of the labs, and we wrote down a couple questions before, but PRP would be good for, like, I know you do PRP, you've helped people with their knees before. That's made a big difference. So that could be a good thing. And then IV vitamins, how often would you recommend IV vitamins?
IV vitamins, they are an indulgent. I mean, because it's the same thing that there's nothing secret about what's in an IV. And at first when I heard about it, I was skeptical. And I think that's kind of just that kind of conventional medical training I had. I'm like, oh, that doesn't make any sense. Why don't you just eat it? Yeah. Until I did it, and it's become.
I've done it. I liked it. I felt better.
It's
when I
definitely
did it.
Yeah. It's a guilty pleasure.
I should have done it after my 2 hikes.
It would have
made a huge difference.
Anecdotes it's the lowest form of proof of medicine, but anecdotally, just what I've seen from doing it over the last couple of years, as far as recovery, performance, it absolutely makes a big difference, because even though you can get everything orally, the dosing, I've convinced myself just from what I've seen in kind of the theories that
You've
are out there.
You've helped a lot of different people, for sure.
It makes it I've seen it make a big difference. Now, it's a lot more expensive than going to the grocery store, but and if you want to splurge a little bit and feel really good, like it makes a big difference. Like I love seeing the results. I love being on the receiving end of it too. The older, more stressed I get.
I hear some of the high-level executives will do it kind of on a normal basis just to keep them tip-top, keep them in good shape.
On that topic, I mean, you calculate it. I mean, you're an entrepreneurial. If you can have a week where you have 3 hours more of production, or the 8 hours, or unfortunately 10 or 12 hours that a lot of these executives are working, like, you do a mathematical equation and it makes sense for even from a financial standpoint. If you can be that much more productive, think that much more clearly, have that, like when you feel good, you want to get things done. Makes a big difference.
Yeah,
so
for sure.
A lot of executives and people that are just trying to perform at a high level, like it really, they really like it, and I understand why.
Yep. So hopefully this guy will move by right now as we're finishing up. Is there any other things that we want to go over? So if somebody wants to go to you, they go to metamedicine.com. Is that what it is?
Yeah, metamed.com.
Metamed.com.
Yeah, METTA med.com. And then obviously CrossFit.
Or reach out to Tirsa or Megan or myself, and we can put you in contact with Trevor.
Yeah, send a text anytime. Yeah.
Totally worth doing. It's really fun to see where your health's at, and really good long term to know where you're at every year. To do that test. Any other tests that people should do regularly, or
these what we did, or is pretty we didn't talk about your thyroid. We checked out your thyroid, but it's what you and I did is similar to what people come into the ER. Sometimes you just want to go to the ER to know that there's not something wrong. And I think that the conclusion that I think that I've had with you is like, you're working really hard. You did some just crazy highs. You did rim to rim, you did Mount Whitney, and so it's nice to know that there's not something here that's glaringly abnormal. That overall looks good. And so I think for us, it's like, okay, we can tweak a few things. Take some vitamin D, get some more sun exposure, do the healthy lifestyle, but at least we don't have to worry about, are you anemic? Is there some weird infection? Is there some, bone marrow, like suppression thing that's going on? And so even if you don't have the exact, like, okay, I know exactly what's going on, it's nice knowing what's not going on just as much, in my opinion.
Yep. Being a car guy, I heard this once, that you want to change your oil in your car, right, to keep it running in the best shape, but a lot of times we have no idea what's going on in our bodies. So if we test our blood, that's like effectively, it could be like an oil change, or knowing at least where your levels are at.
Yeah.
Getting your car checked out, your body checked out every once in a while makes a big difference.
Absolutely.
And a lot of us take better care of our cars than we do ourselves. Yeah. We're usually the person that we let go. I'm reading a book for the second time called 12 Rules for Life by Jordan Peterson.
Oh, nice.
I love that book.
Yeah.
The second rule, I'm going to maybe botch it a little bit, but it's take care of yourself better than you take care of somebody else. And so that one of the first things he teaches in there is people will take better care of their pets than they will of themselves.
Yeah.
So take care of yourself like you would somebody else. And so I really like that idea that we really have to take care of ourselves, and to be the best for somebody around us, it takes knowing where we're at, and doing that.
This is a great way of doing it. Like I've seen young, healthy people that doing everything right. We do the blood work, and we start looking at their creatinine, and it was like, hey, whoa. Let's take a look at what's going on, and then we find out that the blood pressure's high, and then there are some interventions. So starting at 40 as opposed to 60, I mean, that 20 years of making a small intervention now makes a huge difference. You know, that little deviation now can make a big difference. And so that is, you know, if it's not with me, you know, just even your regular doctor, having a good pulse on some of these basic measurements, you know, on that note, making sure your blood pressure is on point. Man, we need to have a whole nother podcast talking about heart rate variability and some of these different measurements with sleep. We should have that for another conversation.
That.
We don't have enough time now for sure. But
do you know the Apple Watch now does that too? Does HRV?
Love it.
So does the Garmin, and then of course Whoop.
Yeah.
But yeah, we could do that.
Yeah. So So anyways, I'm glad you did that. We, you know, we're plan on rechecking it in 3 months. Because you have some goals, and some motivation. We'll check the vitamin D. We'll check your LDL. Keep an eye on your platelets, you know, that'll be a great way just to keep a pulse and make sure that everything's looking good. No red flags.
Yeah, and it wasn't crazy expensive to do. So for those that are like, oh yeah, I don't want to spend the money, it wasn't bad to do. Yeah, and Trever could go over that with you, and he has some good specials for CrossFit preferred members. I know you've helped people in the past.
I can't help it. Like I love working with athletes. You know, CrossFit preferred is, you know, the you know, it's kind of like the extended family. So yeah, I can't help but hooking up the CrossFit preferred people. So cool. Yeah, always throwing some goodies and discounts for the CrossFit preferred. But yeah, and I'm totally transparent with, you know, the prices for the labs are on my website, and so you can check those out. But typically, you know, basic's going to be, you know, as low as, you know, you could get $25 just to get the very, very basic. If you want to just go crazy, you know, it's not going to be more than $350. And so, like you said, like getting a bill for $1,500 is not uncommon.
It kind of makes you not want to do it,
right?
You know, but when it's a couple $100 to know where you're at, it's totally worth it.
I think so, yeah.
You'll put all that work you're putting in to yourself here in the gym and with nutrition is going to make a huge difference for you.
You know, and even though we just got a few pearls to kind of focus on, you know, the vitamin D exposure and the nutrition, I think that's worth the investment. Just having that little bit of motivation, feedback, intervention. So cool. You know, I think it's worth the investment in yourself.
Thanks for being on here today and going over all this.
Absolutely.
And check out metamed.com, and you won't be disappointed. It's awesome. It's fun to work out with Trever and go over. I love nerding out on all this stuff, so thanks for doing that with me today.
Yeah,
really fun.
I love it too.
Cool. Thanks a lot, everyone. Have a great week, and we'll see you soon.